All right. Hello, everyone. We are Painless Healthcare. My name is Victor.
My name is Emerson.
I'm Yusuf.
And I'm Neil. All right, so over the past 2 quarters, we had the great honor and privilege of working with, which is a healthcare company that specializes in providing healthcare data solutions for employers and their employees. This higher accolades, they get a trustable source that can help them manage and collect their employees' healthcare data and records, and can ultimately put this in a personalized format. As a result, this saves employees' healthcare costs because they are put with the right type of care at the right time.
To better understand why health data matters, let's start with a simple scenario. So imagine an employer who has an employee named Bob. Bob was recently rushed to the ER for a heart attack. Even though Bob turned out okay, he ended up costing himself and his employer a lot of money with ambulance costs and emergency room treatment. If Bob had stayed on top of his health and changed his lifestyle to potentially prevent the hypertension early, he would not only be healthier, but he would have saved money on insurance rates. This common scenario is a perfect example of how health data can be used to better personalize healthcare and conduct disease risk analysis. Even though heart disease has fairly clear signs of risk, it is still one of the leading causes of death. Things like age, weight, nutrition intake, and physical activity levels are all risk factors contributing to hypertension, which is a precursor to heart disease. With enough data, accolades and machine learning models can make correlations between all of Bob's health data and attempt to see the signs of disease risk before Bob or even his doctor could. With this prediction, Accolade could have alerted Bob that his health profile indicates a risk of hypertension or matched him with an appropriate healthcare provider to talk about preventative measures.
So what's the problem here? If this is a solution, why doesn't every healthcare company just do this? The problem is that there are far too many data sources and healthcare devices in the world now, and that really makes it difficult for people to see or keep track of all their data. Right now, many of you have devices that are tracking things like your exercise activity, sleep, nutrition, but most people don't use this data for anything useful. While there's a lot of data out there, people have to log into each of their accounts individually for every time they want to view their data. They'd have to go to Fitbit to view their step data, then to CVS to view their pharmacy data, then to Snooze to view their step data or sleep data. Well, you get the idea. And not to mention that once they do get all this data, they're not equipped to do anything useful with it. So to solve this problem, Accolade has tasked us to create the Consumer Health app, which is a solution for users to access all of their health data in one place. Our application provides the consumers a simple and painless way to authenticate and connect with different third-party sources. And after connecting to their sources, consumers can then view their healthcare data in that one place. And not only will this benefit the users, but it'll also help Accolade better personalize the health benefits of their consumers. So let's take a look at the design process. There were 3 main issues that we needed to solve when building this app. How would we access the user's personal health data? And after getting access, how would we format that data so that it's standardized and easy for Accolade to use with their machine learning models? And finally, how would we ensure that the data we do get stays up to date? So we came up with the following: OAuth for authentication, FHIR for formatting, and pulling data when it's available to keep it up to date. So what's great about the OAuth protocol is that users only need to authenticate once, and during that time, they can choose the scope of what data points our app can access, which provides the users control of their own health data. So here's the OAuth flow that we use to access a user's healthcare data. So say a user wants to connect Google Fit for the first time. Our application will pop up a login prompt in step 1, the auth request, for the users to enter the login info in step 2. Our app then passes those login credentials to step 3, Google Fit, the API in this case, and they'll verify that the login was correct and return an access token or a refresh token is step 4 to our app. The access token lets our application request health data from Google Fit in steps 5 and 6, while the refresh token allows our app to basically remember that our user has logged in before, so they could go straight to steps 5 and 6. So let's take a look at the authorization flow in action.
So upon entering the apps section of the Consumer Health portal, a user can search for data sources they would like to connect. Clicking on one of the sources will initiate the authorization flow. Next, the user picks what type of data source they want to connect. For this example, we'll select wellness. We want to connect a Google Fit device, so we'll select that. Next, the user is redirected to an authorization page on Google's own servers where they can approve or deny access to certain scopes of their data. They're then prompted of a successful connection. Upon returning to the apps page, it shows that Google Fit data source have been connected and Accolade now has access to their Google Fit health data.
So the second requirement was that all data pushed to Accolade's database be formatted in a standardized protocol called FHIR, which stands for Fast Healthcare Interoperability Resources. So here's an example of the formatting of data to FHIR. On the left, what you're looking at is an example of some heart rate data we received from Human API. This data is transformed into the FHIR structure that you see on the right. We take fields directly from the left object, the red fields like value, the timestamp, and we pass it straight to the FHIR structure. And then for the blue fields on the right, these contain information that uses universal codes to tell Accolade what exactly the type of data is.
So the final requirement we needed to address was the ability to keep the data up to date. So this is an example of our data flow for Human API. Human API is a service that contains health and biometric data from many various health and sensor data sources. So this is the flow of the data through the API and to our app showing how we keep the data up to date. Number one represents a user's data, like their step count for the day being recorded on a Google Fit device. And then at number two, the second arrow represents the data being sent to the Human API. Once new data comes into Human API, it sends a notification to a predefined URL where our server is listening for incoming notification requests. At number four, this data is then forwarded to the notifications module. And then number five is used to initialize a notification class, which uses the information to prepare a request for the new data. It then forwards the data returned to the FHIR module, which is responsible for parsing any incoming data and formatting it to FHIR data structures. Number seven is then pushed to Accolade's API. And then at number 8 and 9, we also store a backup in our app's DynamoDB table, along with internal data relevant to our app. With the data being updated in our back end while the user is not logged in, they can access the up-to-date data in our app anytime they log in. They can click View Observation Data, which will take them to the dashboard page. The dashboard page holds all the most relevant data from all the different data sources. If the user clicks on the steps card, for example, they can view their new up-to-date data. Each data point shows the value and timestamp and also the correlating data source, so they know exactly where all of their data came from.
All right, so I want to take this moment to talk about our future implementation and what we would have done had we continued to work with Accolade for another quarter. So first thing we would have done was continue to implement other APIs and other endpoints. For this project, we implemented Human and Google Fit API and implemented all of their sources. Accolade also closely works with another healthcare company called Livongo and is particularly interested in their blood pressure readings and their blood glucose data APIs. Our group would have continued to conduct research and analysis using those two APIs. The other thing our group would have done was to analyze trends in relationships. For example, what happens if a patient does not take their heart medication for a week? How does that affect their hypertension? Or what happens if a patient does not do enough exercise? How does that affect their potential sleep cycle? These are all questions that Accolade seeks to answer. So looking back, we learned different and various things as engineers. The first thing we learned was the importance of good design documentation. When we were dealing with lots of code files, it's easy for members of a team to become confused on understanding what certain files do. Having a clear design process allows everyone to be on the same page at all times. Furthermore, we learned it's important to draw flowcharts and have a lot of team scrum meetings to break down complicated tasks. This allows us to break complicated tasks into smaller subtasks, which are more manageable for the team to implement. Some of the challenges we overcame were expanding Accolade's existing infrastructure. They used a particular framework, Next.js, that our team wasn't familiar with. However, by the end of the quarter, we were able to get a fundamental understanding of how it worked. We want to thank some of the key people who helped make this project a success. We want to first thank our sponsor, Greg. It's worth pointing out that in winter quarter, Greg met with us almost every single day. This allowed us to make sure our project was able to flow smoothly without being derailed. Thanks to his time and dedication, we were able to learn a lot and grow as engineers. We also want to thank other members of Accolade staff, such as Ashley Smith, Naeem Udine, and Scott DeWitt. Ashley helped us download necessary software on our computers, which required us to do our project. Naeem and Scott spent time out of their day to walk us through Accolade's Jira board and give us advice on how to assign story points to user stories. We also want to thank Professor Richard Julik for his kindness, professionalism, and respect. He couldn't have been a better teacher to teach this course, and I sincerely hope that he continues to teach this course for a long, long time. We also want to thank our TA Arindam. He met with us every single week and gave us tips and pointers to figure out how we could continue to work well on our project. So if anyone has any questions, feel free to